10,000 health workers just laid off by the U.S. government, and a judge said, hold up, that might be illegal. The U.S. just saw one of the biggest shakeups in public health staffing in decades, and now a federal judge has slammed the brakes on it. Here's what happened. Earlier this year, the Trump administration under Health Secretary Robert F. Kennedy Jr. cut over 10,000 workers from the Department of Health and Human Services, merging 28 federal agencies into just 15. They called it the Make America Healthy Again plan, MAHA plan, whatever. But not everyone saw it as a healthy move. The layoffs hit crucial teams like those tracking HIV, hepatitis, and working on Head Start programs for kids. And the public outcry was immediate, and now the courts have stepped in. This week, U.S. District Judge Melissa DuBose issued a ruling blocking any more layoffs, saying they may have violated federal law and caused irreparable harm. Her exact words was that the executive branch doesn't have the authority to reorganize entire agencies created by Congress. And that's a big deal because it checks the power of the presidency, and it could impact thousands of jobs across healthcare, child welfare, and disease prevention. The lawsuit, backed by 19 states and Washington, D.C., argued that the cuts were not only chaotic, but stripped away vital services and forced new costs into the states. And the judge agreed. She said states lost access to expertise, research funding, and oversight they relied on for years, and all of that was yanked without warning. Health and Human Services says it was just trying to reduce waste in a bloated bureaucracy, but even RFK Jr. himself admitted that mistakes were made and that up to 20% of those fired could be reinstated. Now, the agency has until July 11th to respond to the court, and this legal battle is far from over. And this story matters not just because of politics, but because when health infrastructure is cut, it can affect every single one of us. For more news on health from a pharmacist engineer, subscribe.